Hello guys, this is Dr. Palaniappan Manikam. In this video, we're going to talk about all the facts surrounding the death of an obstetrician and gynecologist in Florida after receiving the first dose of a Pfizer vaccine. This is a very sad news. It's a horrible news. I totally feel for the family. We need to know more about exactly what happened. Let's dive deep into it. This is a 56-year-old OBGYN doctor in Florida, and he got his first dose of Pfizer vaccine in mid-December. 16 days later, he died of hemorrhage into the brain. We need to understand this basic pathophysiology so that we can further evaluate what happened with this Florida doctor. For a person's survival, there should be 3 separate cell lines. So number 1 is the white blood cell. Number 2 is the red blood cell. Number 3 is the platelets. And the platelets will provide the clotting factors. For example, if you have a paper cut, if you are bleeding somewhere, because of the platelets, you are forming clots in that area so that you don't bleed anymore. So the normal platelet count ranges between 150,000 and above. So if it is less than 150,000, we call that as thrombocytopenia, which means that there is low platelets in the body. And when can that happen? It can be because of multiple reasons. So number 1, it could be because of infection. It could be because of medications. It could be even because of food intake, like walnuts. If you eat a lot of walnuts, some patients might develop low platelet count. So the platelet counts can also go down in a condition called ITP, which stands for immune-related or idiopathic thrombocytopenic purpura. What this essentially means is your body produces antibodies against your own platelet cells, thinking that your platelet cells are foreign to you, and it start to eat all those cells up, so you will end up having low platelet count. So this is what we call as ITP. When the platelet count is low, the patient will present as bleeding into various sites. So they will start slowly bleeding into the skin. We call that as petechiae. You will start seeing some skin bleeding superficially. And if the platelet count goes down like 50,000 or 20,000, then it will start bleeding slowly internally. You could start bleeding into your kidneys, we can start bleeding into your stomach, or you could also start bleeding into your brain as well if the platelet count is significantly low, sometimes even less than 10,000. The blood vessels inside the brain, which are so teeny, can rupture and cause bleeding into the brain because there are no platelets to promote clotting. So patient usually presents with stroke-like symptoms, like they cannot move their right arm or right leg. And when we do a CT scan of the head, we could see a white material being deposited in the brain, which is the bleeding into the brain cavity. When he got the Pfizer vaccine on day 1, I think like a week after, he started developing some petechiae, like some small spots in his skin. And he was found to have a low platelet count. Went down to 0. As we talked about before, whenever platelet count goes less than 10,000, there is a likelihood of bleeding into the brain, and that is what happened with this patient as well. This happened so soon that even with steroids, even with newer medications and treatment options, we were not able to save this patient, and unfortunately he died because of the bleeding into the brain. So the biggest million-dollar question is whether this side effect is related to Pfizer vaccine. So the Pfizer company is saying, no, this is not related to our vaccine. Obviously, they are going to say that because no mom is going to say that my baby is the culprit. So he got the vaccine on day 1. On day 16, he developed ITP and he died. So based on the timeline, it does appear to be that Pfizer vaccine might play a role in the diagnosis of ITP. But the only problem to this argument is this ITP can be caused by multiple other reasons, as we mentioned before. So it could be like any other viral infection, or it could be any medication that he might have taken, like Tylenol, Motrin, which is a very common medication, and also food products that can also cause ITP. That is why it is more important to know more details about this case. Autopsy report is in progress. We will come to know more about it in the next few weeks. There are so many other things that can cause ITP as well, including any viral infection, including COVID-19. For example, let's say he got the dose 1 Pfizer vaccine. He is not completely protected from COVID. Maybe he got COVID after he got the vaccine from exposure to something else. And then maybe the COVID-19 caused ITP because of the antibody production. That is a counter argument as well. So if that is the case, how do we really know that Pfizer vaccine has to play a role? Only if this incidence is repeated multiple times. We have given 6 million doses of Pfizer vaccines in the United States so far. There is only one case of ITP reported so far. So it is very difficult to say whether it is related to Pfizer vaccine or not unless we see these cases more often. So given that it is an extremely rare condition, the likelihood of some other factors playing a role in this disease is more likely than the Pfizer vaccine, and that is my take on this. So I'm not being paid by Pfizer at all. I'm just doing this video to create awareness because I'm anticipating a lot of news like this down the road. Oh, Moderna vaccine caused this death. Oh, Covishield caused like 7 deaths. Covaxin causes like 10 deaths, which is very, very common reports because after vaccine administrations, if anything else happens to the patient and causes death, it could be reported that it could be related to the vaccine. So it is absolutely important to dissect the details and then see how common is the side effect, whether it is really related to the vaccine or not, so that we can actually encourage people to make an informed decision. If this indeed comes out to be that it is related to Pfizer vaccine, I'll be the first person to come and report to you guys that yes, hey guys, this is related to Pfizer vaccine, please be cautious. But so far, out of the 6 million doses, there is no reports of significant ITP at all. So we are still waiting. It is too early to conclude. I will definitely give you an update about what happened with the autopsy report. I can reassure you that this kind of presentation after vaccination is incredibly rare. So it's extremely rare. We don't see this often. So in medicine, it is always about weighing the benefit and risk of any intervention. So the benefit of getting a vaccine is, number one, it provides you 95% protection from getting COVID-19. Number two, even in the worst case scenario, if you get COVID-19, the likelihood of getting severe complication is extremely low. And on the other hand, what is the risk if you get COVID-19 that you will have long-term complications? It can affect your brain, lungs and heart. And I have done a separate video on that. Please check on the description box below. Nobody can force you to get vaccinated, but my job is to present you the facts around all these reports. So to dissect which one is true and which one is not. So I will keep you posted of any updates and also of any other reported side effects of this vaccine so that everybody can learn from this. So until then, stay safe and I will see you in the next video. Bye-bye.